Here's foundation for America's public lands. Cool. I think this one sometimes wants. Yeah, so they want at least 1 year in grant management. That's not bad. That's not bad. So I'm going to save these and post them, but I know that it's hard for you guys to grab them. So let's see if I can do this. Oh, yeah. Oops. You guys can tell me where to stop, or is there a term? I'm just switching. You guys can kind of see what I've been, my notifications on lately. So this is my notifications. I urge you all to please leverage your alerts. You have to go through your settings. So it's something like jobs, preferences, right? You have, this is your job alerts. And then you have up to like 18 or 15 or 20. So you can really set these, but the way to do it is leveraging the key terms guide and really aligning to, it's not so much the focus areas, but it's more the skill set. Notice I have like coordination and capacity building. Yes, I'll have social impact. I think I have health equity. Maybe I'll throw in a title like analyst, right? But the titles are not like evaluation analyst, right? It's very simple. So when it comes to titles, if you want to do alerts based on that, please keep it to something simple like director, manager, coordinator, analyst, specialist, navigator, educator. I mean, you could do health educator, sure. But keep it as simple as you can. And then when it comes to skills, right, I'm looking for like project management, operations is more of a descriptor. I do talk more about that in the module 101, where it's about uh, mind mapping and how to describe the work more and more. I feel like operations has been pretty good to my mentees lately. And so I've kept it on here because you can find a lot of companies. Ooh, okay, 16 hours ago. Oh, I think one of my mentees already applied to this, but I'll share it because it's on here. 52 to 60. Yeah, I'll save it. Program officer, nutrition policy, 1 hour ago. Right, you guys have to get used to searching. What is it? 24 hours to past week. I really don't mess with the anytime or the past month filters. Honestly, the past week to 24 hours is your best bet. And then you jump to the bottom. So you look for what they're looking for. This is global health. So this is really what this is that global health space that some of you are interested in. And I guess there is a nutrition angle, so that's great if you have any work in that. Also, they're calling out EPI if you have experience in EPI, or even just policy. Maybe it's not nutrition policy, but if it's other kind of policy, I know like maybe tobacco control would work for that example. I love this. Some of my key terms are showing up that are new. Jenny, going back to your question, the language is evolving, the language is changing. Knowledge management is a term that is growing. Oh my gosh, that was what I was supposed to do is I was going to share with you guys the list of areas that are growing that I've been keeping tabs on. And of course that notebook is, I could do it off the top of my head, but knowledge management was one of them. So it's the space where some of you may have seen it as like the learning environment, like learning or communities of practice. This is a community of practice, right? Public Health Hired sort of has the best model for it is a community of practice where we're basically learning about this employment process and best practices and how to really master something. So that is a community of practice. You probably find yourselves in that at your work. I know at Kaiser we were doing a lot of communities of practice, whether it was for like homelessness and housing or education or workforce development or mental health, like whatever the topic is, we were doing our own communities of practice. I've also seen them as monitoring, evaluation, learning jobs. I'll say that again, monitoring, evaluation, learning. But now this is the new term, is knowledge management. Knowledge management. So if you're looking for new terms to search, this is one. The other thing I've been noticing is don't let technical materials just means technical assistance. Just documents, manuals, toolkits. That's what that means. So I'll save this. I'll put this in the chat if anyone's interested. Could we try implementation? Yes. One thing I want to share, always verify the job posting through company's website. I found a fake job posting yesterday. Thank you, Yuko. Yes, snaps, 2 snaps for you. I agree highly that one of the best practices is to go and find the job on the company site because that is how you're going to avoid scams. With that said, I have found small companies or small nonprofits or little like clinics or sometimes there's just small organizations that don't have their own career site. And so you may run into occasionally those that do have only Indeed or LinkedIn as their option for submission. But if you know they're like a robust company that has their own career site and they're not listing, like to me, that's risky. So yeah, be mindful of that. Thank you, Yuko. All right, let me try implementation. Mm. Full implementation training. Hold on. I'm just like this is this is also why I tell you guys not to search titles because you don't even know how they're gonna pull out with these titles. It's so jarring. It's a mouthful. So obviously this is K through 12. So this is being in the learning environment. Patricia, going back to why you should be disclosing that you've worked in teaching, that you could actually work for Hazel Health on school implementation management if you want to work in that space. Just sort of more as an example of why it's worth us noticing if, you know, how these companies value this experience. Coordinator for Big Brothers Big Sisters. Yep. Great opportunity there for someone. Oop. Texas. No. I'm looking for like remote. Remote. Implementation does pull a lot of IT, so be mindful of that. But then it has something like this. Ooh, Missouri, 1 hour ago. Safe Care Program Specialist. Missouri Network Against Child Abuse. Sometimes anything children related, child related might be social work. Here it is. But then they also will equate public health from time to time. They want knowledge of primary medicine, pediatrician. So 3 or more years experience working in program development, data management, research methods, training, coordination, and delivery. So this is a specialist title. So there's a little bit of training probably they want from this person. But still, notice how we found it through the term implementation, right? I think for me, it's just sort of pointing you guys to how to search and how to do this for yourself better. Maybe this exact example is not for you, but Program services coordinator, program services. Like, seriously? What? That is not the full, you guys, the title is not. Great, when you're coordinating logistics. Okay, done. Okay, but is this public health enough? What is this? Logistical pieces of our assigned program, each program, monitor registration, AV vendor, AV vendor, AV vendor. That's throwing me. What do you guys do? Sometimes you just have to open up who they are. Might be IT. Oh, so there's something about communications, healthcare. Okay. I think it's just they might be a little more on the private side. Hey, it's a remote job. Okay, I'm going to stop implementation. I'm going to mix it up. Something maybe program delivery. That's been program delivery and programming. Both of those have been much more fruitful than like coordination or outreach or anything like that. Think of also program delivery, programming. No, not programming like coding. There are jobs that are literally describing our work as you're programming things into the community. So it's just following their language, to be honest. Ooh, Director Youth Impact. I don't know if I've promoted this recently. This seems familiar. Oh, they had a social impact. Someone had a social impact, not youth impact. Maybe they changed it. I don't know. So this one does want minimum. Oh, Lean Six Sigma. Want to provide more information on these? Yes, because I think you guys are running into them too, obviously. Um, and you don't like have to have all of these certs, but I will say for some of you that are interested in certain data management or analysis or evaluation or quality control work, it might benefit you from. In fact, I just talked to someone about the difference of a couple of them just to kind of help her narrow down her options. But that to me is, that's your call, that's your decision. So I'm happy to, I would love to include that into the masterclass recording. Maybe what I'll do is I'll at least record what I have so far, and then if there's any like certification conversations, I can add that. I'll stay 5 minutes extra. I think we got started at 9:05, so I can stay at 10:05. It's okay. This one does want a supervisor, so this one is a little more for those of you who have supervision experience. Can we just see this? What is happening with the public lands? Public lands, protect them. Yes, agree. But there's lots of companies, I guess, in the game. Data management, grant administration, events. Mm. Program coordinator, education, Vituity. Oh, I haven't seen them in a minute. They were growing, and then I just didn't see them for a while. CMEs, SMEs, yes, 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 yes. Learning environment. This is knowledge management slash learning. CMEs are continuing medical educations. SMEs is subject matter experts. So usually that means this is a job for helping with their medical professionals continuing their education units required for them to keep their license and credential license, I believe. And so a lot of hospitals or health plans will have their own CME program. And this is a great avenue for those of you who have a CHES or are in health education or love health education and just don't know what your options are. This is one of your wonderful options. I love these jobs because there's oftentimes remote. Sometimes they do want you to be on site if it's like, for example, I know someone who does it here at City of Hope, loves her job, but like they wouldn't need her on site. That's here in Los Angeles. But then sometimes there's like companies like this that probably just want you to be like available remotely for a variety of issues. Anyways, love it. Love CME spaces. So if you're looking, you can search CME or just continuing medical education as one of the search terms if you like that option for you. And notice I found it through program delivery. Again, what term am I using to find this program coordinator job for education for CMEs at Vituity Health? Program delivery. There's our weird title again. Okay. Associate, also great entry role title. Associate, nonprofit global development partner. Um, network-wide technical support. That now tells me it's, oh no. Oh my gosh, look at how even they call technical support technical assistance. This is where they lose us, right? This is where they lose their candidates. Even though they're trying to talk to you guys, they're probably not reaching you because someone will X this out, reading it as technical support. But when you actually read it, right, it's technical assistance. Do you guys see that? That's why I tell you guys, you have to know what you're reading. Is like technical assistance is the world of public health and healthcare, helping someone go through a very specific process or guiding someone with toolkits and manuals and agendas and presentations, whatever the thing is. I provide technical assistance to all of you. It's essentially what I do all day long is I provide technical assistance. If you need something, where is it? Right? Can you send me that? Can you train me on that? Like, can you develop this for us? Can you, it's like technical assistance. What do you guys need? What do you need to get you through to do the thing that you need to do to complete your task? Right? Because my task is your task, right? Like you need a job and I want you to get a job. So we work together on this. So it's the same idea in any role when you're doing technical assistance is you need someone to complete something, you walk them through that. That's all it is. Okay, so I'm going to save this, also put it in the chat. Questions on technical assistance or what we just saw there? I think that's a good confusing one.